Bat flies into woman's mouth while vacationing in Arizona. Picture this nightmare scenario. You're enjoying a peaceful vacation under the starry Arizona sky when suddenly a wild bat rockets straight into your open mouth. What happens next will shock you and might make you question everything about our healthcare system. This isn't some horror movie plot. It's exactly what happened to Erica Kahn, a Massachusetts resident who found herself facing a medical and financial catastrophe during what should have been a relaxing getaway to the Grand Canyon State. Kahn was spending time at Glen Canyon National Recreation Area, just outside Flagstaff, last August. As an amateur photographer, she had ventured out to capture stunning images of the night sky, a popular activity in Arizona's dark sky regions. The evening seemed perfect, with bats gracefully dancing through the air around her. But here's where it gets absolutely wild. One of those bats made a beeline straight for her face. In a natural reaction, Kahn let out a scream, and that's when disaster struck. The bat flew directly into her open mouth and remained there for what felt like an eternity, though she estimates it was only a few seconds. Now, here's the part that might surprise you. Kahn didn't believe the bat had actually bitten her. Many people might have simply brushed off the incident and continued their vacation. But Kahn's father, who happens to be a medical doctor, insisted she seek immediate hospital care and begin rabies vaccinations as a precautionary measure. And this is where the story takes a controversial turn that exposes serious flaws in our healthcare system. Kahn had recently lost her job and was living without health insurance, a reality that millions of Americans face every day. Recognizing the potential severity of rabies exposure, which is nearly 100% fatal if untreated, she made a desperate decision. She purchased a health insurance policy online immediately after the bat encounter, before heading to the hospital. Here's what the insurance company told her when she called. She would have coverage for life-threatening emergencies. Rabies exposure certainly qualifies as life-threatening, right? Kahn believed she was making a smart, responsible decision to protect herself both medically and financially. The rabies treatment protocol is no joke. It requires a series of injections over several weeks. Kahn began her treatment in Flagstaff and continued receiving shots at various medical facilities as she traveled through Arizona, Colorado, and eventually back to Massachusetts. But here's where it gets controversial. When the medical bills arrived, Kahn faced a staggering total of $20,749. That's more than many people make in half a year, all for a freak accident that lasted mere seconds. The insurance company's response? They denied coverage entirely, claiming Kahn hadn't met the mandatory 30-day waiting period required by her newly purchased policy. Think about that for a moment. A 30-day waiting period for a policy that supposedly covers life-threatening emergencies. How exactly is someone supposed to wait 30 days when they need immediate treatment for potential rabies exposure? This raises some uncomfortable questions about our healthcare system. Is it ethical for insurance companies to have waiting periods for true medical emergencies? Should someone be forced to choose between potential death and financial ruin? And here's the kicker. Was the extensive rabies treatment even necessary if Kahn wasn't actually bitten? Some medical experts argue that rabies treatment should only be administered after confirmed exposure through bites or open wounds. Others maintain that any contact with a potentially rabid animal warrants immediate treatment, given the fatal nature of the disease. But here's what most people don't know. Rabies treatment itself carries risks and side effects, not to mention the enormous financial burden. Kahn is now fighting on multiple fronts. She's negotiating with healthcare providers to reduce her medical bills and simultaneously appealing to her insurance company to reconsider their denial of coverage. Her case highlights a troubling reality. Even when people try to do everything right, seeking immediate medical care and purchasing insurance, they can still face financial devastation. This story exposes a fundamental problem with our healthcare system that goes beyond just insurance coverage. It's about the astronomical cost of medical care, the complexity of insurance policies, and the impossible choices people face during medical emergencies. But here's the part most people miss. Could this entire financial nightmare have been avoided? Some countries provide rabies treatment at a fraction of the cost, and medical tourism is becoming increasingly popular for expensive procedures. Should Kahn have considered traveling to Mexico or Canada for treatment instead? What do you think? Was Kahn's father right to insist on immediate rabies treatment? Or was this medical overkill? Should insurance companies be allowed to enforce waiting periods for emergency coverage? And most importantly, how can we fix a system that forces people to choose between their health and their financial future? Share your thoughts. Do you think our healthcare system failed Erica Kahn, or did she make mistakes in her decision-making process? Have you or someone you know faced similar impossible choices during a medical emergency? A bat encounter gone wrong. The costly lesson of health insurance. A tourist ended up with a wild bat in her mouth and nearly $21,000 in medical bills, KFF Health News. In retrospect, Erica Kahn realizes she made two big mistakes. The first was choosing to temporarily forego health insurance when she was laid off from her job. The second was screaming when a wild bat later landed on her face. The bizarre encounter happened last August, while the Massachusetts resident was photographing the night sky during a vacation at the Glen Canyon National Recreation Area in Arizona. Kahn, now 33, noticed a few bats flying around but didn't worry about them, until one flew up to her and got tangled between her camera and her face. She screamed, and part of the bat went in her mouth. She doesn't know which part or for how long, though she estimates it was only a few seconds. It seemed longer, she said. The bat flew away, leaving Kahn shaken. She didn't think the animal had bitten her. Regardless, her father, who was a physician and was traveling with her, said she should go to a hospital within a day or so and begin vaccinations against rabies. Figuring she would be covered as long as she obtained insurance before going to the hospital, Kahn said she found a policy online the day after the bat incident. She said she called the company before she bought its policy and was told services related to an accident or life-threatening emergency would be covered. Kahn went the next day to a hospital in Flagstaff, Arizona, where she started rabies prevention treatment. Over the next 2 weeks, she received the rest of the rabies shots at clinics in Arizona and Massachusetts, and at a hospital in Colorado. Then the bills came. The medical procedure Kahn received a total of 4 doses of the rabies vaccine. The doses are administered over the course of 14 days. Along with her first vaccination, she received 3 shots of immunoglobulin, which boosts antibodies against the virus. Rabies is typically transmitted through bites or scratches from an infected animal. Experts recommend precautionary measures. https://cdc.gov/rabies/hcp/prevention recommendations when a person has been potentially exposed to rabies, because once the neurological disease causes symptoms, it is fatal. www.wnnt Newsroom Factsheets detail rabies. The Centers for Disease Control and Prevention says post-exposure rabies treatment has reduced the number of human fatalities to fewer than 10 a year in the U.S. The final bill, according to explanation of benefit statements, Kahn owed a total of $20,749 for her care at the 4 facilities. Most of the charges were from the hospital where she was first treated, Flagstaff Medical Center, $17,079, including $15,242 for the rabies and immunoglobulin shots. The billing problem. Most insurance doesn't start immediately. Kahn's policy did not pay for any of the services. The required waiting period for this service has not been met, said an explanation of benefits letter she received in December. Kahn was stunned. "I thought it must have been a mistake," she said. "I guess I was naive." When Kahn was laid off from her job as a biomedical engineer last summer, she had the option to temporarily stay on her former employer's insurance under a COBRA plan at a cost of about $650 a month. But as a young, healthy person, she gambled that she could get by without insurance until she found another job. She figured that if she needed medical care, she could quickly buy a private policy. According to the Centers for Medicare Medicaid Services, those who qualify for COBRA must be given at least 60 days. https://www.cms.gov/ccio programs and initiatives, other insurance protection/COBRA_Q&A to sign up, and if they do, the coverage applies retroactively. Kahn, who was still within that period at the time of the incident, said recently that she did not realize she had that option. The policy she purchased after the bat episode, which cost about $311 a month, was from a Florida company called Innovative Partners, LP. Documents Kahn provided to KFF Health News say the policy has a 30-day waiting period, which does not apply to benefits regarding an accident or loss of life. Kahn said that after receiving notice that her claims were denied, she called the company to ask how she could appeal and was told a doctor would have to file paperwork. She said she wrote a letter that was signed by a doctor at Flagstaff Medical Center and submitted it in March, but was unable to reach doctors at the other facilities. Kahn said she was given conflicting answers about where to send the paperwork. She said a representative with the company recently told her it had not received any appeals from her. Benefit statements Kahn received in early July show Innovative Partners had not paid the claims. The company did not respond to requests for comment for this article. Sabrina Corlett, co-director of the Center on Health Insurance Reforms at Georgetown University, said most health coverage plans take effect on the first day of the month after a customer enrolls. The insurance companies, for good reason, don't want people to wait to sign up for coverage until they are sick, she said, noting the premiums healthy people pay help balance the costs of paying for health care. Email sign up, https://kffhealthnews.org. Subscribe to KFF Health News' free weekly newsletter.